Yes, you're gonna have people turn their backs, but it's time for us to keep it real. Just keep talking that real, bro. Do what you do. I know what you do, so keep doing that. Talk the real.
The HBI lads will see you now. See you now. See you now.
I don't want to cause no problems. I just want to live my life, but I keep on hearing about nonsense.
Alrighty, welcome back to the HBI podcast. We are on episode 6. This is health, business, and in between. I'm Nathan Bridger, chiropractor. Join with me always the soon-to-be hairless man, Mr. Ben Humphries, physiotherapist. How are we doing today, Ben?
Hey, lads, I'm good. How you boys doing?
Always good, always good. And looking even darker than usual because I think he forgot to turn his light on in his office. Our myotherapist magician, Mr. Minagaris, how are we?
Gentlemen, how are we?
Very good, very good.
Good.
I'm excited to be here with you boys.
Always.
Can't miss an
excited.
episode.
Mate.
Yeah.
People,
I'm
make
excited
sure.
to be here.
We keep forgetting that these are actually going to go out to the public at some stage. So make sure you are subscribed and always give us a 5-star rating. If you don't want to give us 5 stars, email us and tell us why, and we'll fix it up. But more importantly, there we go. So what are we talking about today? We talked about it last week. We guaranteed that this week would be talking all things pain. And a bit more fun, a bit more like, not fun, because pain's not always fun, but understanding pain so people can do the right thing, go to the right place, and get the right result. So, with that in mind, who wants to kick us off with a bit of a understanding of what pain actually is?
I'm happy to
Go,
give
Benny.
it.
Go, Ben.
All right. So we all know pain's a massive topic, and obviously, as practitioners, we deal with people in pain all the time. That's the main reason why people come and see us. So this podcast today is going to be about, obviously, each of our perspectives on what pain is, why pain exists, like why should you come and see me versus Nate versus Mina, what should you look for if pain is in your body and all that sort of shit. So I think that pain as a whole operates in order to protect our body from damage and from future damage. So pain, I believe, is not always a physical representation of what damage has occurred in the area. It's either a representation of the damage or of potential damage that's going to happen. So I believe that's a good way to kick it off. So Mina, what do you reckon?
Completely agree. And there's different types of pain. I think that's kind of what we want to let everybody understand and help people understand is, what sort of pain am I getting? Is it something coming from an organ? Is pain coming from a joint? Is it pain coming from a tendon? Is it pain coming from a muscle? Is it pain coming from nerves? So once we kind of understand the sorts of pain that we're going through as humans, we can better educate ourselves in terms of what do I need to do to prevent it? What do I need to do in terms of treatment? What do I need to do in terms of rehab? Or is it out of a therapist's hands in terms of osteophysio, myo? Is it something I actually need to see a doctor about? So once we kind of understand our bodies, getting this fixed is going to be a lot easier.
That's right.
100%. And I'll even throw a spanner in the works because I like to be a giant nerd like this on what Ben said before. And I think what a lot of people don't understand in my mind is that pain in itself, or our personal perception of pain, is a purely emotional response.
Mm-hmm.
So when people say it's all in your head, it is truly all in your head, but it's not. And so what the definition is there is obviously, as we know as educated people, nociception is the actual sensation within the body. This is the signal. We hit the neurotransmitter, we hit the nerve, it goes to the brain, and then it's interpreted in the brain as some kind of a response. And this is one of the reasons why, all three of us here can have the same experience and have very vastly different levels of pain or problem.
Yeah. That's right. It's very, as you said, it's emotional and it's contextual to the person. So like anything, right? Like what I experience is different to Nath, and what Nath experiences is different to Mina. So we unfortunately don't have a comparison to say, I don't know what you feel and you don't know what I feel. So it's a very hard thing to objectify and to blanket, slate it as like, this happened to me and I feel this. So that's definitely what Mina feels like.
I think the big thing is pain it's always real, right? Like even if you have an issue where there is no damage, per se, your experience is still real. And as a practitioner, that's an incredibly important part for us to deal with.
Yes.
Because if we're not meeting the person at their experience, you know, you might think, oh, I've had that. That's not that big a deal. But if that person, for them, it's a big deal, it's not your right to go, oh, well, it's not a problem.
You can't tell someone how they're feeling.
No, and this is in that classic, I don't know if you guys have it, part of my like standard new patient is, you know, can you give me a rating on the pain, average and worst, out of 10? 10 is, you know, 0 is nothing, 10 is the worst pain imaginable. And, you know, there's a lot of people that will tell you that their like back pain is a 10 out of 10 or 11 out of 10.
That's their
Now,
10 out of 10.
Yeah, exactly. And I'm like in my mind, I'm like, I imagine getting shot, breaking a bone, you know, like childbirth's probably more, but it's less about what's actually like the number actually is and more how they're perceiving it.
And they're just indicators.
Yeah.
It's very relative, right? To the, like, so we delve into it a bit more, like, as we said, it's very contextual, it's very individualized pain and very subjective. So my past experiences and what I've felt in the past and my genetic makeup and, you know, everything else, every other variable will contribute to my sensation of pain. Like, and it depends on it's very situational too, I believe. Like if you're in a life or death situation, suddenly your broken arm will start working again and you will obviously not feel the pain or not near as much as what you'd feel if it's in a completely sober situation where your adrenaline's not pumping. So as we said, like it's completely contextualized to you as a person and to the actual situation at hand as well.
Yeah. And I think here's a big question for you both straight away. Is pain always bad?
No. No, for me, this is what I try and tell people. Pain's a great thing, right? Because it's just like, you know, as Maddie mentioned, put in a post once, you know, it's like your engine light. It's a signal to tell us. The body is telling you, hey, something is not right. Yeah. So obviously it stops us from our daily activity, which is why people don't like pain. But if there's something going wrong, then it gives us an indication of what's actually happening. And I think what makes my communication powerful with my clients is I actually educate them a lot on what's happening. Okay, so you're getting this sort of pain because of X, Y, Z. I get it. So by doing this sort of movement, that's going to aggravate that. So how can we kind of work around that to eliminate that sort of pain while strengthening at the same time? So that education piece from the practitioner is so critical because in here, instantly pain's gone from a 10 to a 6.
Yeah.
When you came in, it was 11.
You've de-threatened it a whole lot.
Yeah, like as my one of my mentors once said, he's like, sometimes the most powerful adjustment that someone gets from me is the one between the ears. You know, if you can explain to people what's going on and you can get things moving, like people can be like, and also normalizing it, because it is normal. Like, especially I always think of shoulder rehab. And, you know, my past is 13 separate, like AC separations. Like, I know this, Jam. It's going to hurt as part of the rehab focus with the shoulder is that you're going to have pain. It's just the nature of the joint. You know, we are trying to work within a functional range of that. But if you tell people, they're like, because they'll do your rehab and they're like, man, my shoulder hurts, so I stopped. So I was like, listen, talk to me, hurt? Like, was it like you couldn't move it? Was it killing you? And they're like, no, I just started feeling some little bit of soreness. I'm like, all right, I need you to work through that. Like, awesome. That's allowed. You're allowed to have that. You're allowed to have that within 12 to 24 hours after, because we have to do that. That's normal muscle soreness in terms of strengthening muscle in order to make you better.
Perfect. So that's going to lead us perfectly down, all right, types of pain. So, Nate, you want to roll there? So run us through what, you know, you just mentioned basically on rehab. So you touched on delayed onset muscle soreness. So what should you be looking out for as a person exercising when you're doing either rehab or any sort of sport? Like what's good pain? What's bad pain? What should you anticipate? Should you be sore afterwards? Hit us up with a bit of a insight into that.
All right. You know you're getting an analogy, so here it comes. So I run what I like to call
every time.
the traffic light system. So again, we go back to that original pain scale, 0 to 10. So 0 to 4 out of 10 pain is a green light. Now this is, you know, it means it doesn't compromise your activities of daily living or your movement. So I can still move full range. I have a bit of like an achy, maybe a little bit of throbby, a bit soreness. So something that's more of an inflammation-based or muscle-type pain, but I'm able to keep going. If we shift up between a 5 to a 7, you know, this is where you're starting to not wanting to go certain areas. Perhaps it's starting to get pinchy, starting to get some sharpness coming in through there. We're starting to think more, maybe the joint itself, maybe we're thinking a little ligament, you know, still can definitely be muscle because like we can't, I always laugh when people come in, and you probably get this, Mina, the same in the vice versa, where people come to me and it's like, oh, I went elsewhere because I was like, oh, it's a muscle issue and chiros don't help muscle. And the same, you probably get, I was a joint issue and myos don't help joints. So like, I'm like, well, what's attached? Like muscles attached to the joint, everything's attached. Like I don't just go, well, I'm going to leave that one, but that's another time. So then we get that. So that's where in that section of rehab, training, stuff like that, my big look there is we need to make an adjustment. And that's, do we need to change the type of movement, the volume of movement, the tempo, stuff like that. Like it's not a no, it's a just how do we make it work so we can stay in the green?
It's a no for now. Like,
and that's what I always say to people, like there's more than one way to move a muscle. Yeah, so 100%. You don't have to keep doing the same repetitive stuff. And actually, Nate, you've hit it perfectly because a lot of the time, I'm just going to stop.
Yeah.
That's their first thing to do. And then they get really bad. There's nothing wrong with the Chinese like massages in the shopping centers, but then they feel tight. Then they go there with no examination, no assessment, no knowledge of prior history, and just rub, right? Yeah. So
the problem is, like, if you just want a massage for the sake of a massage, that's totally fine. But if you're going there for treatment, that's very different. People need to there's a reason why it's hard to get in with good practitioners. It's because they know what they're doing. But finishing that analogy, the over 8 is the red light, right? This is the actual stop. Now, again, like you said, it's a stop for now. And it's like, and then for me, it's like the classic, you know, when people come in, they've been told never to deadlift again. I'm like, well, I'm going to stop you deadlifting for 7 days. And then we're going to do rack pulls. And if those work well for you, we're going to slowly lower that back down to the floor. And if that's all working well, you're back and you're good to go. But it's a not now. But 8 out of 10 pain. Now, this is like, I can't move it. I feel like something's going to not break, but, you know,
that's how it feels.
There's a threat. There's a real threat there that you're generally concerned. Like there's very few people have not had a moment in their life where you're like, that is very wrong. You know what I mean? You're like, maybe like something's just like, you got to push something up and you're like, no, that's a no from me. So that's kind of how I look at it. So when we break that back down, so you get to your base pains, you know, your soreness, your dull aches, you know, your delayed onset muscle soreness kind of stuff, and that's tends to be your more chronic-y style pains or your more muscle stuff, things like that.
Right.
You then come up to, like you said, you're sharp, you're shooting, you're burning, you know, tingling. Those start to get a bit more nervy. They start to be a bit more potentially linked to a bit more joint damage and stuff like that. And they can often be a lot more in the acute phase than more your chronic stuff. You know, if you're having chronic, you know, and again, we haven't defined this. So acute, less than 3 months. Chronic, more than 3 months is a very basic sort of acute versus chronic. But if you've had like shooting, radiating pain down your arm and burning into your hand for more than 3 months, you should have done something about that by now.
It didn't just start like that most times. This is a nasty trauma.
Yeah. It's not just like, oh, that'll get better. Like if you've had that, and I've had people, they're like, oh, it's been going on for about 6 months. I'm like, so why are we doing something about it now? Like what's changed that you're like, nah, that's a problem?
Like now I can't sleep and my arm doesn't work. So I thought that'd be time to get it worked on. It's like one lady I had in one time, where the old practice I used to work at, she was cooked, man. Like she came in with like this shoulder problem, and you know, you go through your general subjective shit. And I was like, oh, what's going on? Rah, rah, rah. How long has it been going on for? She's like, oh, it's been going on about 12 months. It's been gradually getting worse. And she was right-handed. It was a problem with the right shoulder. I'm like, all right, it sounds like she played it down pretty hard. Whether she was a bit irrational, who knows? And then I'm like, all right, got up to the objective assessment. And I'm like, all right, show me how your shoulder's moving. Got like 30 degrees shoulder flexion, like max. I'm like, what's stopping you there? She's like, oh, it just really hurts. I'm like, how long has it been like this bad for? She's like, oh, about 6 months. I'm like, what have you been doing? Like, your dominant arm is operating at like 15%, and you think that you're going to get looked at 12 months later. I said, what's wrong with you?
But I think, and sorry to cut you there, man, but like, let me ask you this question, because I know my answer, but where do you think that idea comes from for you guys? Like, why do people think things will just get better?
It's like, it's based off the past, obviously, because things in the past is sometimes a good predictor of the future, you know, like if I've had this pain in the past and when I was younger, you know, 10 years younger, this thing just went away. So it's conditioning from your own anecdotal experiences, but also then your outside influence. So it's like, oh, my mum has this same problem and she says it's pretty normal. It's just part of getting old, you know, it's conditioning from.
And you're like, what does your mum do? And she's like, oh yeah, she's a receptionist. You're like, cool.
Yeah.
Yeah, and I struggle with a lot of clients like that because obviously we want to help them. And I say to them, all right, I had a lady who said, oh, you know, surgeon said, and surgeons, I'm like, look, I'm no surgeon, but from basic diagnostic testing, we can see that there's no limit. She literally, so when she was raising her arms, it was like,
yeah.
I'm like, okay. And I'm like, let me just guide your arm up and let's see if there's actually any structural issues. Let me know if there's any shooting pain. I'll close your eyes. Yeah, I'll keep going. Go close your eyes. Yeah, that's fine. That's fine. And I had a whole arm. Yeah.
Yeah.
Okay,
For the record, for people who aren't watching the video, Mina just had his arm straight up over his head.
Yeah. It was
right, so she was able to lift. So when she raised her hand, one hand was about 50%. Yeah. As high as the other one, right? So actually, I helped her to basically lift her whole arm up, and basically all it was her lats were really jacked up, her rotator cuffs were quite weak, and she basically needed a lot of strengthening to kind of get her up to where she needs. I had literally 4 sessions with her over a period of 6 weeks, and she was crying at how much like she could actually lift now, right? Right. So a lot of time people have been burnt over time. You know, they've seen doctors, they've seen surgeons, and it's like cortisone or whatever. Like just like you said, just experiences, right? Not that stuff doesn't work, but through experiences, these things happen, and people just get, oh well, that's how it's going to be. I'll just manage it, and if I get sore, I'll maybe get a rub or something.
Well, this is the jump in here, because I think you alluded to it, but it didn't hit it. We can't forget, and you see, I definitely think you're seeing a shift in the younger generation, but it's definitely part of the older. We can't forget that their education on health was rest and bed rest. Like if you have back pain, you lay in bed for 2 weeks. You know, if you have shoulder pain,
it's a good point.
Stop and you rest it. Mm-hmm. And now, of course, we know that the guidelines say that is the worst advice possible.
Rest is rust.
But we have to remember, beautiful, love it, like just because we know it, so many people haven't had that transferred down. And it's still because it makes kind of sense from survival mechanism. It's like, it hurts when I do that. I should stop doing that.
That's right.
And so people think they're doing the right thing, but then you get that classic case, and I'm sure people listening will say something where you're like, I had this issue, so I stopped doing the thing that was causing it for a couple of weeks. Then I went back to doing it again because I like doing it, and it started hurting again. And they just go through that cycle rather than ever getting things looked at and sorted.
And that's what I said, touching base what I said earlier. This is where we need to educate as much as possible and help them understand, in layman's terms in a way, but the basic anatomy behind why it's doing what it's doing. And when I kind of break down the job of a ligament versus a muscle, what a ligament's made out of, what a muscle's made out of, so that's why I can't do X, Y, Z. Yeah. You know? I said muscles give you power, ligaments give you range. So yeah, all right, you can pull it up, but you can't extend. Right, so we help them kind of break down what's actually happening, and then they've got a better informed way of making a decision.
100%. And I think something that I really want to jump onto today, because we talked obviously pain earlier. It's not always a bad thing. It's highly protective for us, you know. And it's that classic. We've got those reflexive pain loops where, you know, if you step in a fire, you don't have time to be like, well, how do I feel about this? Your body just pulls it out and protects you. You know, it's that same primeval thing that if you walk out in front of a road, like on the road looking at a truck, and you're not like, probably could take it. No, you get the hell out of Dodge. Your body's not thinking about it, right? But
You're trying to
when you guys, we all see a lot of people that are in pain, and a lot of them, like we said before, have let it get really bad.
Mhm.
What are some of the things you think people could just look out for to be like, hey, it's time, before this actually gets painful and starts affecting my, day-to-day life or my performance, if we're talking an athlete, what are things they should be looking out for in their day-to-day life, in the gym, stuff like this, that's a sign that something's coming and they need to get ahead of it?
Right. Yep. I'll shoot in, Amina. Well, I believe, pain, obviously, as we said, helps, protect us and keep us safe and that sort of thing, but it also can be very detrimental. So I believe when pain starts affecting your happiness, your function, it starts stopping you from doing what you want to do, pain-free, or whether it be, to the full capacity that thing is, I believe you should be starting to ask a couple of questions. All right, why is this sore? It never hurt before, but now it hurts, and now it's actually stopping me from doing the things I want to be doing.
But how do you know before it starts hurting, Ben?
Well, you've got some warning signs. So you
All right, let's go. Tell me the warning signs.
All right, you've got an area becomes a bit more sensitive than it did before. You used to touch your elbow and it didn't hurt, but now suddenly it starts hurting. It's not exactly giving you real symptoms, but the tissue's starting to get a little bit more sensitive than what it used to. Your muscles are now acting a little bit tighter. Like my stretching's now a bit harder than usual. My shoulder's not moving as freely as it once did. It's still not giving me actual symptoms, but there's some telltale signs happening now that my body is not functioning the way it was 2 weeks ago. And then lastly, the power, the strength might not be there like it was before. So there's signs of weakness, signs of hypersensitivity in areas, and there's signs of joint range of motion and muscle restriction.
Boom. That's the big dog for me. But I'm going to let Mina drop out anything extra in before I jump on my rant train in a moment.
No, I agree with Benny there. And I think as well, get curious and really pay attention to your body. And we've got such access to everything at the moment in terms of social media, right? Forums, podcasts, all that sort of thing. So depending on the type of person that you are, and this is where I kind of break it down, are you a person that's active? Are you a person that's are you quite heavily around the gym, or someone who just goes for
Mina, we lost you from over there. Can you repeat that bit?
Yep. You hear me now?
Mm-hmm.
Yep.
So knowing the type of person that you are, so you're an active person or someone who just kind of, just basic gym stuff. Are you walking or you just basically just sit at your desk all day? So understanding your actual patterns, right? A lot of people then will, I haven't been to the gym in ages. So the first time and then they'll go hard out. So understanding what your body's actually capable of, and then being able to recognize, I've been actually training for a while. I've never really just kind of felt that before. But being aware of what your body's doing and paying attention, like while you're training, these are sorts of things that you can pick up as triggers. And then understanding the types of pain that you go through. Is it a sharp pain, dull pain? Is it more I've got no reach? These are the sorts of things that I would kind of look at. And then I would ask a therapist around, this is what I'm feeling. Is there something I should look at?
Yeah, 100%. And if I my biggest things, it's one of the big things I screen in the office. Even if someone's most people are coming in with pain, but as one of my favorite sayings is, pain's the last thing to come and the first thing to go. And the biggest mistake is people make their health decisions on an end stage issue. Like if you're only doing servicing your car when the engine blows up, you're doing yourself a disservice. So, what's the obvious things? Like if you were driving your car and it gets a bit shaky on the road, that the tires need a bit of issue, But so for us, especially, I think the people that should notice it the most are those more active people. But if you're, your range of motion, your ability to move your joints starts to get limited. If your sleep starts to be an issue, if your balance starts to be an issue, if you're not able to control or stabilize movements, one of the classic ones I see people come in, they're like, I got no pain, but when I bench, one arm comes up faster than the other. We're seeing power deficits,
Right.
We're seeing, especially for your bodybuilders, they're seeing asymmetry through muscular development, These are all precursors that we may be going to see some later issue. And it's
Yeah.
stuff that's obvious. And I think it's one of the things I find the funniest when people come in and they tell you everything and they're like, sorry, you do your job. You know what you're talking about. I was like, no, nobody knows your body better than you. So please tell
Keep
me
going.
everything, because it
Yeah.
doesn't matter. Like, people, like one of the things people like, you're checking someone like after you've been working on for a week or so, and they're like, how's it looking? Well, I don't have x-ray vision a lot of the time, so I can't say, but I always say, like, well, you tell me, how are you going? They're like, oh, I'm still sore, but I've noticed I'm moving better. Good. So we're seeing some stuff starting to change. That's great.
Yeah. Our job as the practitioner to obviously be objective without testing, but you also be mainly subjective, because I believe that when people say the same thing as you, Nath, right? They come in and say, look, I'm feeling better, but what's the tissue feeling like and that sort of thing. I'm like, well, the most important thing here is that you're actually feeling better, and your quality of sleep is now better. Your quality of day-to-day living is now better. Now, obviously, your tissue is going to tell me a very similar story, because if you're now feeling good and pain-free, your tissue is going to be a little bit softer, a little bit more malleable. It's going to function a little bit better. It's going to be a bit more balanced. Yeah, so the body will then, the body follows the mind. The mind feels good, the body will feel good.
Yeah. And you touched on something there, Benny, and a question that I've been asking lately, and actually a lot, is, look, I get 45 minutes to an hour with you, God knows, out of a month, right? So tell me a little bit about lifestyle. What does work look like for you? What does stress look like for you? Tell me a little bit about life, not
Stress is
nitty-gritty
massive.
detail, but it's actually such a large thing. And what I say to people is, when we stress, there's certain chemicals that release that inhibit growth.
That's right.
Right? So if you can kind of, and I tend to break a few barriers when I ask this question, and people just come to that realization of, actually, you know what, I have actually had a lot going on, and I actually haven't been training for a while. And I went back, I go, okay.
Yeah,
So we can see that it's actually stemmed from something, and when you kind of ask these questions, it helps them kind of rethink, actually, you know what, maybe I do need a little bit of me time, just to kind of relieve stress.
Very true.
I mean, one of the cornerstones, and this goes a bit deeper with people that I deal with that have more like pain syndrome. So something like a complex regional pain syndrome, where we have what people used to describe as like phantom pain, where that you've had an injury to a joint, that injury is healed. This person has every MRI test ever that shows that let's say shoulder is perfect, but they're in chronic pain from it. You will always, and I would and I hate to make like definitive statements, but you'll always find there's gonna be a background of high stress there.
Yeah.
And so often in that case, and there's a really good book, I think it's called The Divided Mind by John Sarno, who's specialized in this kind of mind-body pain thing, where like it's often the body going, well, you're not dealing with this emotional issue, so we're going to give you a physical thing to focus on. Yeah. And what we now like have seen in a lot of the research is if you actually work as a myo, physio, chiro into that injured tissue that's not injured, you actually reinforce that sensitivity and make them worse. So by, because it's already hypersensitive, because there's already issues within the brain, feeding more information into that just puts fuel on the fire. And so I have a client that I've worked with recently, a couple of months back, who had seen everyone, was sent to me by another chiropractic colleague of mine for a shoulder issue just like this. And I told him on day one, I was like, so I'm going to do everything but touch that shoulder. I literally worked, so he had a right shoulder issue. I worked entirely on the left side of his body, trying to create overstimulation of the other side of the brain to try and bring things down. Yeah. And yes, there's some serious stress stuff going on. We talked as much as we can and made recommendations about that, or referred appropriately. And we saw over 6 weeks that chronic pain that'd been there for months basically disappear. Get back in the gym, get things going. Yeah. But it took a lot of trust, because again, you've come in for an injury that you believe truly and wholly and is there in terms of what you're feeling. And I've told you I'm not going to touch it to make you better. Sounded weird, but it's just a random case study I thought I'd throw in the end there.
Yeah.
Right. It's like, as I said, it's going to be very contextual. And that'll be the very rare case where you'll have that parasympathetic dystrophy, whatever it's called, chronic regional pain syndrome.
Yeah, chronic regional pain syndrome, which they keep renaming and causing different things. And it wasn't a pure one, but you see a lot of that kind of like it's like Parkinson's. There's like 12 different things lumped into that could be any one of those things.
It's a hypersensitivity. Like,
Yeah.
it's basically, to everyone listening, it's basically when your body or your tissue gives you a disproportionate pain response to the actual stimulus. Let's say if someone touched you on the neck and you had this really sensitive neck, the actual soft touch elicited this massive pain reaction, migraine, all that sort of shit. Like that's not normal. So that's when you start falling into that rare category of like,
it's kind of like being sunburnt. Normal pressure on your arm doesn't hurt. You get sunburnt, suddenly it hurts a lot. But it's like being like that constantly.
it's not good.
Yeah, it's rare, but it's a big thing, and that's why understanding, for practitioners, understanding pain variations, syndromes, even the rare ones, and like we've said all along, questioning, like as you're working with someone, is what you're doing helping and getting that feedback? Because otherwise, this person had like, it was a lot of treatment. I can't remember, from various practitioners on this thing, and it had just kept getting worse.
Yeah, and it just leads into, all right, well, obviously we've all got different skill sets, and let's say if they've seen 5 different myotherapists and they still can't fix the problem with massages, and as you led there, Nath, it's like, well, chances are like that treatment method is not going to be as successful as I hoped it would be. So let's try actually a bit of functional stuff. Let's get you moving again. Obviously, it's very contextual, as long as there's not any major signs of damage and trauma. And then, as you said as well, obviously get it moving, get you strong, but referring out to potential people that they might need to see. So whether they need to go see a sports doc or a pain psychologist, or whether they need to, as you said, Mina, look at fucking emotional stress and psychological stress that they may be going through. There's a lot of different avenues to
Avenues, man, heaps.
Pain is complex as.
Yeah.
All right.
Look, we can't tell you how you're feeling, but we can help guide you through it. Yeah. And I think this is what makes us kind of powerful, is we've got such an amazing network. So all you need to do is ask. So everyone listening, it's just, if you feel something that's not right, reach out, like to any of us, even like we'll tell you, look, this is what we think it is. Why don't you go see Nath, or why don't you go see Benny, or come see myself, and we're going to be able to guide you through, and just that support network is just enough to kind of alleviate that first challenge. So,
but one thing I will caveat to that is, like I said, everyone, just ask, just reach
that's
out,
it. Just get curious. Yeah.
But do something with the information. Like, the amount of times I see people on like Instagram asking for complex diagnoses from like a simple bit of my shoulder hurts when I do this. My usual thing is like, I've got this problem. All right, cool. Where are you located? I will send you to the best person I know in that area.
Right.
But you have to go do that. Like as you'll see in almost every post I put up, the Instagram, Facebook, YouTube is not there to substitute a well-trained health practitioner.
That's right.
It's there to assist and give you information and education so that you can make the correct decision on where to go. But you need to be careful, because like I'm sure all of us will say, I'm seeing more and more people in the office that started doing stuff out of context that they saw on the internet to fix them. And I put out quick fix stuff to help people, but you need to read and you need to understand what's going on. So I think, as we come into close today, like, pain's a pain. It's simple as that. Pain's a pain in the ass, quite literally, but it's not all bad. It can do a lot of good for us.
Yeah.
And just ask and get help. Like anything, just ask.
That's right. Well, let's keep going on that route, like a bit more about, so if you are working out, what should you, let's say if you experience a bit of pain in your back when you're doing your bent over row. Now, Nath or Mina, what are your go-to strategies first before stopping the actual movement?
For me, it's about just kind of understand and feel the pain that you're going through. Obviously, if it hurts, stop doing it, right? Initially, because a lot of the time, if it's low back, if your posture's off, there could be a number of things that are going. So if it's an instant sharp shooting pain, and Nath, you probably differ, but if it's a sharp shooting pain, just recognize the pain that you're going through, okay? And if it's that intense, the rule of thumb is going to be stop. Maybe try something else. If another workout is still aggravating you, let it go and go get it checked out.
What's something in session that you can do?
Well, let me,
So I think
if I jump,
foam
if I
roll.
can jump on there for a moment. Like, Mina's right. Like, really depends. Like, if it's
Yes,
just
it's-
soreness, like if I'm doing row and I'm getting soreness through my lat, I'm meant to get soreness through my lats. That's what I'm
Yeah.
working on.
I understand the pain
Yeah.
you're supposed to get.
Yeah. If you're getting sharp stuff, well, then straight away, you know, if I was doing a bent over row, let's say I'm doing a pendulum row, you know, like that full bend, that 90-degree bend. Well, maybe I'm going to come out of that 90-degree position. Maybe I'm going to go to more of a 45-degree row and see if that calms things down. Because, you know, that can be a vulnerable position for the low back if you're not doing it right. Am I wearing a belt? Or am I not wearing a belt? If that's not working, but I still want to do the work, do I just want to go do a cable seated row or a machine row where I'm supported, you know? Those kind of things. Like, and like you said, like if it's already starting during it, could you do, we could do some foam rolling, perhaps we could do some light stretching or some more functional based sort of work. And
A
again,
bit of a warm-up set.
what that would be, and it really depends where you are. Like if this is your second last set of a session, you probably just call it, you know what I mean? But if this is first one in, well, then you probably need to take a bit more time to go through a bit of prep to actually get things going. But it's hard to make, like, I don't want to give you anything definitive because it depends, because it really depends on what we're dealing with rather than, you know, pain, like we've just said for this whole, you know, better part of half hour, pain is so subjective that we need to know what we're dealing with before we can put an intervention to it.
That's right. Yeah. So as you said, adjust your technique. Tilt your pelvis this way, that way.
Yeah.
Maneuver your shoulder blade till it feels comfortable. Reduce the weight. Find an alternative exercise that will do the same thing without giving you lower back problems. There's a lot of things to trial, especially what you said, man, a trigger ball, foam roll, activations, etc. There's a lot of things you can do before ceasing the exercise or activity that will help. And as you said, like it's very dependent on, is it severe pain or is it just a mild, uncomfortable pain?
And it could be as simple as the weight's too heavy.
Yeah.
It's as simple as that. You know?
It's that core combination again of like any time we need to modify a thing, is it range of motion? Is it tempo we need to think? Is it the actual weight being lifted?
Technique.
Is it the technique? And then is it the actual like variation that we need?
Yeah.
Because, you know, you could be rowing, but maybe now we're going to row off a block. So it's a bit less depth, you know? Maybe we're going to tempo it so you're not bouncing at the bottom and losing your position. Maybe you are hyperextending through your low back, which is causing you to shear across it, you know? Maybe your ego is making you just pull too much weight. So
That's right.
there's always options there, but it's all about, all right, what have I done? All right, let's try. Don't do all of them. Try one at a time. And if it sorts it, beautiful. If none of them sort it, that's where you need to look elsewhere.
And for people that are in a gym, you know, grab a PT, grab someone, am I doing this correctly? Is there another way that I can move this muscle? And if you kind of go through a PT and they're like, okay, no, something might be aggravated, PT might say, look, I'll probably go get this checked out. And then maybe come back, we'll do a bit of a rehab program, you know. So ask the question, like, so many times at the gym, like there's all these big bodybuilders when I first started, I'm like, you look like you know what you're doing. Come over here, give me some help. So don't be shy to ask, because you could be saving yourself a lot of pain and a lot of money.
Good. I want to, depends what we want to do here, but I think briefly touching on the whole pain mechanism would be good. Like, so I'll if you guys are happy, I'll lead into something. Now, pain is a muscle inhibitor, right? It actually can decrease the output in the actual power of the muscle that's affected in the fibers that are affected in the muscle. So obviously when pain's around, your power is going to be less. And obviously when there's pain around, if there's less power, there's going to be a greater injury risk. So that's something to be aware of when you are training. So if you are trying to push through certain types of moderate to severe pain, you're going to have actually a decreased muscle function in that area, which is then going to lead you to an increased injury risk of the surrounding joints or tendons or whatever it may be. So I think that, so you go.
And like, I think we both shared the same thing the other day from Mick Hughes about an increase in overall strength showed a overall reduction in injury rates. It was like, if you could get up to, I think it was a 3 times body weight on trap bar deadlift, showed huge reductions in injury. So it's one of those, like, we know that, I believe it's is it substance P or whatever it is in the neurotransmitter that creates the nociception, but it creates inhibition through the fibers, which leads to a decrease in strength, which is going to probably lead you to put more of your force into actual structural, so ligament, tendon, bone tissue, rather than functional, more muscle tissue, which is going to predispose you to injury. So we need to be strong, but if we're pushing, you're not seeing the forest for the trees kind of thing, with the, if you're just trying to put like, I'm just going to get pushed through this to get it stronger.
Yeah. And one thing I kind of really want to touch on, and I had this with a client yesterday, like we spend a long time building these rehab programs for you. And there's a really good reason why they're built the way they're built. So, and I try and explain this. I had a lady yesterday, like it's a process. Yeah. I'm pretty much undoing 9 years of stuff that's gone wrong. So when you're up to week 2 in your rehab plan, nothing's happening. Bigger the base, the bigger the pyramid. So the more effort you put into yourself in terms of rebuilding that, I can't change the muscle, but I can rehabilitate it to get that strength back. And that doesn't happen overnight, right? Stick to the process. And if something's not working, just check back with your therapist, because a lot of the time it will work. It'll just take time.
Yeah. And I think that's the plan, because I wouldn't let Ben make it this week. For next week is to go through that, creating buy-in for patients for both therapy and in terms of rehabilitation, but then understanding, I guess, at the same time, what a quality rehabilitation process should look like. So I think definitely episode 7 will be coming in, getting that buy-in.
Communication, huge.
Yeah.
So critical.
Yeah, we all know when you communicate something effectively, if you think of something in your, if you're thinking apple and Nathan's thinking orange, and then we're trying to communicate on the same level, it's obviously a problem with the guy communicating. So communication is very vital. And as Mina touched on pretty heavily, is communication is pretty effective when the education is there as well.
Yeah.
So I guess as a wrap up, I think understand the type of pain that you're getting. Okay. Get curious and ask the people around you. And as Nathan said, that's great to get the information, but actually do something with it. Yeah. Right. So these are the sorts of, and as health practitioners, educate your clients, educate the people around you. And this is why I really love the content that you guys put out. And we're feeding you guys so much knowledge and so much information. Take that up and just understand and know your body.
Yeah, 100%. Any last remarks from either of you two boys? I think Mina closed it out pretty good there, but anything you want to say, Ben?
No, I think it's all covered very well. Like that's given us a very, basic overview of what pain is, and that's very digestible for our clients listening. So in the future, we can always delve into more complex stuff.
Absolutely.
That's a very good start.
Well, ladies and gentlemen, that was episode 6 of the HBI podcast, Health Business in Between. Follow the conversation on social media. Let us know what you think. Make sure you subscribe. And as always, leave a 5-star review. We'll catch you next week, and we'll be talking about communication and buy-in. So stay tuned. Thanks, lads. You have a great day.
Good boys.
Hold on.